You hear me mentioning some medications and some other interventions that might be happening. And so I just want to do a brief overview of those. I'm not going to go into any detail, but in terms of pain relief, we talked about the different measures of, the five senses and positions for coping. Those are all natural remedies for dealing with it. But there are medications that are available. Nitrous oxide is given through a mask. It is you inhale it and you breathe that during the contractions to help. Fentanyl is a narcotic drug that is given intravenously, and that can help deal with the pain. Typically, they don't like to give that really close to delivery because it does pass and you can have a more sleepy baby, a more tired baby. So that's one of the interventions that they like to use earlier on. Most people have heard of the epidural. Epidural is when they put a catheter into the spine and help to numb lower down. Once you do get an epidural, though, you are restricted to being in the bed. So people who want to move around a lot, it's good to take note of when you're going to get this type of support, because once you do, the different positions and the changing and the movement is not possible. I was going to say much harder to deal with, but actually it's not possible because you're going to be confined to the bed. Other ones, a spinal is similar to an epidural, but it's given a little higher up in the back, and it like completely numbs, where sometimes with epidurals you can do more motion, like flip over in the bed. Spinals are more, I don't want to say more powerful, but they cover a more larger portion of the body and they're a stronger medicine. So that's pain relief. Then there's the other things that come in order to expedite the labor. These are called augmentations, meaning, can Pitocin be administered without an IV? Pitocin for afterbirth is administered typically with an injection in the thigh. When it's given for increasing the contractions during birth, it's typically given with an IV. So it's given different ways. Some augmentations that happen even before you go into labor, you may be offered the sweeping of the membranes. And what this is your medical provider will physically, with their fingers, separate the space between the cervix and the uterus. That is a mucous membrane there. So separating that membrane does release some hormones that can get labor going. And that's something that you may be offered once you get full term, especially if you're already a couple of centimeters. So sweeping the membranes or separating the membranes is what it's called. And it is a medical procedure. And it's just typically separating that bag of waters from the cervix. The other, and with that, you can see some spotting, you can see some contractions starting. It's completely optional. It can be uncomfortable, but it also doesn't guarantee that labor is going to start. Another one is misoprostol or Cervidil. These are medications that are given to soften and prepare the cervix. So this is typically once we say we want to get an induction, and there can be medical reasons for inductions. There can be elective inductions, but either way, some of these will be taken into play when it comes time to induce the labor. And what that means is you'll be given a first step induction to soften it. So with the miso, they typically crush the pill and apply it directly to the cervix. With the Cervidil, it is like a gel infused like tampon that is put in there, but these are direct measures that are going directly to your cervix to do the work on that part of your body. There's also a Foley balloon, which can be placed. This is a catheter that's inserted through the cervix, and it has a little like inflatable tip that puts pressure on the inner part of the cervix. So the goal of that is to get your cervix opening without medication. It's a non-medical way to do induction. They don't do this if the bag of waters is open already, because there can be a risk of infection whenever you're inserting something inside the cervix and the bag of waters is already open. Typically, you can even go home with the Foley, like it comes out after you get to 3 or 4 centimeters. So these are very, very early interventions that are happening. Pitocin, we already talked about, but Pitocin is given to increase the intensity and frequency of labor contractions. And that's when they give it to you in the IV. And it's a synthetic version of oxytocin. Oxytocin is the hormone that is released that kickstart pregnancy. It's also the love hormone. And so Pitocin mimics that in the body, and it can augment labor and cause uterine contractions. Another intervention is the actual breaking of the bag, the rupture of the bag of waters. This is typically done with a little plastic hook that goes into the cervix, so you have to already be dilated at some, to a certain extent. And that is able to break the water bag, which then releases and can cause, the idea behind it is that it will cause the baby to go lower down into the pelvic and help the process continue. We like to do this if the baby is low already, because there can be issues if the baby is high and there is no water bag that can cause some stress to the baby. So this is something that happens kind of later on. My daughter is chasing the puppy. Sorry, y'all. That's a lot of action over here. So we want to do this during active labor, and we want to make sure that, your labor is progressing with this. So this is one of those things where they're like, hey, you've been in labor for a while. You don't seem to be progressing. We can go ahead and break the bag of waters. It's a non-medical way to make things progress. And then on the pushing and birthing side, we have the vacuum and the forceps. So during the pushing phase, if someone is having a hard time, perhaps getting the baby, out under the pubic bone, or you're pushing, but the baby continues to go back up and is not able to stay down, you can get them some assistance from your medical provider with a vacuum that can be put onto the baby's head and help to suction out, or the forceps, which are like tongs that will go and actually kind of help maneuver the head out. And then, of course, if there is an issue and we're just not progressing and the baby's not able to come out, we will be able to do a cesarean section in the hospitals. That's where that happens. And typically, if it's not a planned one, it's because there's been either some heart rate or issues in terms of like distress, whether the baby's in distress or mom is. And so they're able to do a cesarean section and very quickly get the baby. Any questions about interventions or augmentations that you may encounter in the hospital setting or in birth in general? Okay, I see something popped up here in the chat. Can the vacuum or forceps be dangerous to the baby? Yes, there are risks to using the vacuum and the forceps. And risks to mothers, especially in terms of tearing. If the vacuum is inserted and comes out, it can cause bruises or like little sacks of blood spaces in the head from where the suction was. And the forceps are a little more risky because you are actually grabbing the baby's head and maneuvering it. So there can be some damage done as well. So we like to only use those if it's really necessary and you're having a hard time. How long can no progress happen before a C-section is recommended and required? There's a lot of different factors that go into recommending a C-section, and so it's not necessarily time, but I can guarantee you that if your water has broken after 12 hours, they become really concerned about infection and will offer C-sections if you are potentially stuck at say 6 centimeters for several hours and there's meconium or the cells and heart rate. That's typically when the cesarean is recommended. But I don't know if there is a standard. For instance, if you've been in labor for 20 hours, we want to do a C-section. And this is another moment where you want to use your brain and ask the benefits, the risks, the alternatives, and use your own intuition and really take some time to consider it, because it is a big decision to go into abdominal surgery. If it is medically necessary, an emergency, your doctor will say, like, we need to do an emergency C-section. This is what's happening. But any other time, you can definitely advocate based on your own intuition and what you feel. Because you are the master of your own body. Let's not forget that. Even when we go into these places and we're entrusting them to help us, you are the ultimate decider for what happens to you.